Can we do it?
Hello everyone, Namaste, and welcome to this special Doctor's Day podcast by JConnect. Today we are honored to have with us Dr. Pravenkumar R.R, MBBS, MS, DNB, MCH, a highly skilled surgical oncologist with extensive experience in cancer care and surgery. Dr. Pravenkumar is recognized with the University Best Researcher Award in 2023. His area of expertise include head and neck cancer, breast cancer, Urological Cancer, Gynecological Cancer. With a strong academic background, is cancer always life-threatening?
The advancements of treatment facilities available nowadays. I'm a first generation doctor.
How you have started your journey?
Late stages of cancer also have good survival rates nowadays. Cancer is, to begin with, is generally painless.
Okay.
So these are the main symptoms or signs which you should be aware of.
Okay.
Your body is giving you a sign there, and then it can be detected early.
Reduce the risk of cancer.
Our diagnosis might be wrong.
और ये वर्ड बहुत ही सबके लिए एक बहुत बड़ा मतलब टेरर है. अगर पेट दर्द भी है या छोटा भी कुछ प्रॉब्लम है, हम तुरंत गूगल करते हैं. गूगल पे सबसे पहले यही मैसेज आता है कैंसर.
Survival is little less.
Is there any vaccination for this to prevent?
It is available to be vaccinated for all kids. The willpower to fight cancer is very important.
Before starting today's podcast, we would like to thank all our viewers and supporters. Over the last 6 months, JConnect has completed a wonderful journey, and we are grateful for the love and encouragement you have given us. During this period, we have successfully recorded more than 30 podcasts, bringing inspiring stories, expert insights, and valuable information to our audience. We have one small request. Please subscribe to our channel and support our milestone. In the coming days, we will continue to bring more informative and meaningful content for you. Also, let us know in the comment section what topic you would like to cover next. Your suggestions will help us create episodes that are useful, interesting, and relevant to you. Thank you for being part of the JConnect family. Now let's begin today's special Doctor's Day podcast with Dr. Pravenkumar R.R. Hello sir, welcome to JConnect podcast. And first I would like to wish happy Doctor's Day.
Yeah, thank you very much, and thanks for having me in this podcast.
Thank you, sir. So, shall we start?
Yeah, sure.
Okay. So, my first question for you. Many people fear the word cancer. Is cancer always life-threatening, or can it be cured, detected early?
Yeah. So that's a good question, and the answer lies in your question itself. So my answer would be people need not fear cancer because, as you rightly pointed out, it is when detected early and with the advancements of treatment facilities available nowadays,
Yes.
and with the armamentarium which we have nowadays with different facets of oncological team and different drugs and modern precision care,
Yes.
I think people need not fear cancer anymore.
Yes.
The key here is early detection.
Yes.
For that, the barrier should be broken. The fear barrier should be broken definitely, and people should come forward for symptoms, or if they have been diagnosed with cancer, they need to get treated at the earliest.
Earliest. Yes. So basically, early detection is better.
Yes,
Yes.
definitely it's better. Even if they fail to detect early, even late stages of cancer, still it depends on the various aspects of cancer.
Mm-hmm.
Even some late stages of cancer also have good survival rates nowadays.
Yes.
It all depends on the type of cancer and when it has been detected. So people need not fear. That is the bottom line.
Yes. So I would like to get to know about your journey, like how you have started your journey.
Yeah, I did my MBBS at Madras Medical College.
Okay.
Then I got through my masters in general surgery. I did it in Gynecological Medical College here. And then my surgical oncology was my passion. And this would be called a super specialization.
Yes.
We go from MBBS to specialization to super specialization. So this super specialization I did it in the field of oncology. and basically I'm a surgeon, so my profile would be a surgical oncologist.
Okay. So is there someone in your family already from background they are
No,
in this field?
I'm a first generation doctor.
Okay, great, sir. Generally, it happens like father is doctor, mother is doctor, so we thought, okay.
We were from those generation where getting into medical school, we were all crazy during school time, and I was among those
Yes.
people there.
Nice.
And I really like to enter medicine, and that's how my journey into the field of medicine began.
Oh, great.
Way
Sir.
back in 2007.
Okay, okay, sir. Great. So, what are some early warning signs to cancer that people should never ignore? Like, if any sign body is giving.
Yes, the problem lies with is because the cancer is, to begin with, is generally painless.
Oh,
So
yes.
what brings a patient to a doctor is usually some sort of pain or discomfort is what it brings. But the problem with cancer, especially breast cancer or breast lumps, or any oral ulcers, which may be cancerous, are all, to begin with, it is usually painless. So,
we'll not get to know.
so we can get to know. The thing is, you should not take the pain into consideration. You should take into consideration the symptom there. That is the swelling. You have any kind of lump,
Okay.
palpable anywhere, especially for women in the breasts,
Yes.
and in anywhere which is any swelling which is seen in their body, and especially if it persists for more than 2 to 3 weeks. So these are the main symptoms or signs which you should be aware of. This is regarding the swellings. And in persons who are used to having tobacco, either chewable tobacco or smoking, or any forms of tobacco, any oral ulcers, which usually painless to begin with,
Yes.
and which persists for more than 2 to 3 weeks,
Okay.
definitely you should be aware of, and you should go consult a doctor. And the symptoms which I'm going to enumerate now, like the painless ulcers or the lumps which you get, or I don't mean it to be cancers,
Yes.
but it should be. But you should,
We have to go for detection.
yeah, you have to go for
this.
detection.
Yes.
And if you have any persistent symptoms, say you are feeling having a loss of appetite, you're not able to take food properly,
Okay.
you have digestive issues, you have pass blood in motion,
Okay.
or any testicular swelling, or any ulcers in the skin, or
Okay.
any mole which changes color in 2 to 3 weeks time gradually.
Oh,
So
okay.
anything like these symptoms which persists for more than 2 to 3 weeks,
Okay.
you should not neglect.
Okay.
Your body is giving you a sign there, and it means you go and consult a doctor. The doctor will definitely examine you. If it appears to be, or if he suspects to be a cancer, be a primary physician or a family physician,
Okay.
he will refer to a specialist, and then that's how cancers can be detected early.
Okay.
You should not neglect these signs.
Yeah, so it's not only about pain. There are so many symptoms,
Definitely.
as you have told.
Yes.
So it's not only about we have to wait for pain.
Yes.
Okay.
So if pain comes into a symptom of cancer, it usually presents little late. When only the stage of cancer goes to second, third, or fourth stage, usually pain sets in. So it's better. These symptoms are there, and you think it is needs doctor consultation. Don't wait for it.
Okay.
Especially anything which is happening to your body consistently for a period of 14 or 21 days, say 2 to 3 weeks or 4 weeks time, go have a consultation with your
Yes. So
Be
generally,
any
our
doctor.
body gives some kind of
Yeah,
sign
definitely.
which is
It-
not
yeah,
normal.
yes,
like,
yes, yes.
So we have to.
No taboo should be there.
Mm.
Nothing, any private part or anything you feel, go consult an appropriate, your own doctor, your gynecologist or your surgeon or your physician. They will have the eye to detect those issues, and then if they don't have the time to detect, they will refer to a super specialist, and then it can be detected early.
So better to visit doctor as soon as possible
Yes.
after seeing any type of symptoms,
Yes.
like you had described now.
Yes.
Okay.
And one more thing is take part in screening programs also.
Okay.
The basic health checkups which you go across, say you are 35 years or 45 years, do a baseline health checkup which they do in master health checkup. And for some cancers, we have screening facilities also, which even before you get those symptoms, you can detect early with those screening procedures. So all these screening programs can participate, and you can.
So nowadays,
stay
so
close.
many facilities
Yes,
also
definitely.
available.
We have to make
utilize it. Yes. Sir. Okay, sir. So my next question is, what simple lifestyle changes can viewers make today to reduce the risk of cancer?
The first important lifestyle modification I would like to suggest is for those who use tobacco,
Okay.
be it any form of tobacco. smoke tobacco or smokeless tobacco, chewable form, whatever form of tobacco is to be avoided. It is an important cause for many lifestyle diseases as well as cancer. So better to avoid tobacco in any form. And regarding alcohol consumption, it is not very unsafe, but I would say limit your alcohol consumption. Alcohol consumption can have a synergistic effect with tobacco consumption and can lead to certain cancers. So avoid smoking and avoid any form of tobacco and limit the alcohol consumption would be the very important point I would like to share. Second thing is some gastrointestinal cancers, say some stomach cancers, some colon cancers are associated with processed foods and processed meats, tinned foods and canned foods, prolonged refrigerated foods, and food with high salt content. So all these kind of food items, processed meats and excess pickle usage, high salted foods, it's better to avoid those to reduce the risk of gastrointestinal cancers. So, and regarding obesity and working out, it is always to strike a balance between good balanced diet and some exercises. Suppose you are having a sedentary lifestyle, your work is sedentary, then limit your calorie intake as such. So maintain a good balance so that you are not obese as such. Obesity is not directly linked to cancer, but it has some part in cancer care. So it's better to have all these modifications. These are all preventable, definitely. So these are all within our hands. So I think we can definitely have these modifications and help to fight against cancer or any lifestyle diseases.
So आज की डेट में बहुत बार ऐसा होता है कि हमें अगर पेट दर्द भी है या छोटा भी कुछ प्रॉब्लम है, हम तुरंत गूगल करते हैं. गूगल पे सबसे पहले यही मैसेज आता है कैंसर, और ये वर्ड बहुत ही सबके लिए एक बहुत बड़ा मतलब टेरर है. तो कैसे हम इस चीज़ को समझेंगे? क्या हमें सोशल मीडिया पे डिपेंड होना चाहिए इस चीज़ के लिए? कैसे हम इस चीज़ को जज करेंगे कि ये सही है कि गलत है?
Yes, social media and medicine, there are lots of information available online.
Yes.
And to pick the right information is difficult.
Yes.
So what I would suggest is, whenever you watch a video or a reel or something, just see the background of that person who's giving you the data, whether he is a qualified person to give us those kind of medical information. Suppose I'm a doctor, I cannot go and go on live telling about manufacturing, engineering and so and so. And so what I mean is, check the background of the person who's giving that information and whether it is backed by a scientific organization or not. And don't go behind random influencers who are not the expert in that field.
Yes.
Here the field is medicine. So don't go behind random data and don't get confused, and definitely don't Google.
Yes.
Google, it gives you some So we take the history from a patiently, and then we examine, and there are so many procedures before arriving at a diagnosis. Our diagnosis might be wrong. So we have two or three differential diagnoses also. Those differential diagnoses will be finally pinned down by all the investigations which we do. So this takes such amount of knowledge to come arrive at a diagnosis. So just simply googling and getting a diagnosis will just press the panic button, and it will drive you crazy sometimes. You will not go and seek the right guidance at the right time. So
we have to be careful.
Yes, and nowadays even many doctor influencers are coming into the scene, posting Instagram reels. Many people have certain judgments about it, but what I feel is, okay, at least some qualified person is giving a qualified information so that other bogus informations are not reaching the people.
Yes. So right information,
right information from the right person should be taken. Others are all to be pressed aside.
Good sir. So ये इन्फॉर्मेशन बहुत ही हेल्पफुल होगा हमारे ऑडियंस के लिए, कि अक्सर ऐसा होता है कि हमें कुछ भी प्रॉब्लम होता है हम तुरंत गूगल करते हैं और उस पर 100% ट्रस्ट भी कर लेते हैं. बेटर है कि आप पास के हॉस्पिटल में जाइए, क्लिनिक में जाइए, आप अपने फैमिली डॉक्टर से पहले कंसल्ट कीजिए. तो मेनी पीपल डिले द स्क्रीनिंग ऑफ कैंसर, मे बी बिकॉज ऑफ फियर और वी कैन से कॉस्ट also. So what is your opinion on this?
I would say cancer care takes months to treat. Definitely there is a financial burden for the family. I agree.
Yes.
So what I would like to suggest people is to have some kind of health insurance whenever possible at the earliest. You know, it helps the family at crunch time, definitely. And regarding health and financial perspective, as I told, early detection of a cancer not only helps you the disease to be cured, it also reduces the financial burden.
Okay.
So early disease detection means the complexity of the treatment is less. You get only a single modality of treatment is usually sufficient to treat that cancer.
Okay.
So definitely the duration of treatment will be less and the expenditure also will be less. So early detection always helps you both in cancer cure as well as reducing the financial burden. So that's the way to look at it. So you have a variety of healthcare providers who provide the same kind of treatment at different centers in government setups as well as in good private setups. So it all depends on which place you want to get treated and so on. So definitely, as such, cancer treatment can be given at an affordable cost depending on the strata which you want to be treated.
For state, I like there are so many states in this. Like sometimes I like simply in my relative or something, if they are suffering, so they used to tell ki I got to know in my second stage or third stage.
Yes.
So like what is this stage?
Yes. So stage, what to put it in simplified terms, usually we describe cancer in stages. Usually the stages will be 4 stages, 1, 2, 3 and 4. This is the common terminology which we use to describe cancers.
Okay.
Around the world, this is common terminology used.
Okay.
So to put in simple terms, so stage 1 or stage 2, it means that the cancer which is there in the particular part of the body is staying at that particular place. So it does not spread to in the bloodstream or to the lymph nodes or to distant parts. So this is the stage 1 and stage 2. I don't want to go into the details between stage 1 and 2, but to put in simplified terms, stage 1 and 2 means cancer is at the part located where it is supposed to be located.
Okay.
It is located at that particular part and it is not spread to the other parts. So stage 3 means usually we have lymph nodes. You know, these are all lymphatic structures. It means it is there in the axilla, in the groin, in the neck, so on so regions, or in any abdominal part it will be there.
Okay.
So any cancer which is spread to this lymph nodes or nodal basins, usually they stage it as stage 3. So it has gone one stage up. And the fourth point is the cancer is disseminated and it is spread to the other parts of the body. So this stage, the purpose of this staging is usually to prognosticate the disease. It means stage 1 has better survival, stage 2 survival is little less. So these are all the 4 stages of cancer, and this helps you to know about the survival at different stages actually. You know, to put in simple terms, stage 1 is good, stage 4 is the worst stage. That's it.
So this term is basically for like the normal talk.
Yes.
So people will get to understand.
Yes, people also will get to understand, and it's also for the medical practitioners to understand. So stage 1 has particular kind of treatment. Stage 2 you have different 2-3 modalities of treatment being combined. Stage 3 and stage 4 you have different treatments available. So this is to prognosticate as well as to treat the patients, and as well as for the patients to understand in simplified terms.
Okay. So, but the symptoms will start visible from stage 1 itself.
Yes, not necessarily in all cancers, but few cancers, stage 1 also there will be symptoms some kind of symptoms will be there. As I told, those kind of symptoms which you should not neglect.
Okay.
And for those cancers which are even before the stage 1 sets in, we call it as preclinical stage.
Oh.
We have screening facilities available. We have screening facilities available for breast cancer and cervical cancer, as well as some colon cancers, and as well as some lung cancers also. These are all called as screen detected cancers. So even before this cancer sets into stage 1 or stage 2 or before stage 1, we can detect using these screening modalities actually. So that is why I tell all, especially all women after 40 or more than 40 years of age, to get screened for breast cancer and cervical cancer. So these 2 cancers are the most common cancers in women.
And they have to go for regular checks.
Yes. So a simple screening test will always help you in detecting these cancers early.
Or generally women, they used to be busy in their household work and they are neglecting all these.
Yes, so that's why spend just a day's time in a year for these kind of checkups. Apart from your master health checkups, These screening checkups we call mammogram test. I think you'll be familiar. Mammogram for breast cancer, and some pap smear testing and other testings are there for cervical cancer. So these cancers can be detected early in women.
Okay. Is there any vaccination for this to prevent cancer?
Yes, I think we had lots of information in the social media that there is a magic vaccine available from Russia and so on, so to treat all kinds of cancers. So the reality is we have very good cancer vaccine now developed for cervical cancer.
Okay.
So this cervical cancer vaccine, now it has been indigenously developed in India. It is available to be vaccinated for all kids, especially the daughters.
Okay.
Age 9 to 14 years is the time to vaccinate, and this has been incorporated in the vaccination schedule also.
Okay.
So this information should be passed on to everyone. So a vaccination at 9 to 14 years of age has more than 99% of chance of preventing cervical cancer, which is an important cancer burden in India. So this is the only vaccine which helps in preventing cancer, especially cervical cancer. That's the only cancer vaccine which we have right now. And certain viral infections, hepatitis B vaccines are all preventive against these infections, which might later cause liver cancer.
Okay.
So these are the two vaccines which are currently available.
So indirectly hepatitis vaccination
yes.
will also help for preventing cancer.
Yes, that's right.
Okay. कई बार ऐसा होता है कि हमारे फैमिली मेम्बर में अगर किसी को कैंसर है, रिलेटिव्स में या नेबर या फ्रेंड को, तो हमें बहुत ज़्यादा इमोशनली सपोर्ट की ज़रूरत पड़ती है. लाइक नॉट मोर देन लाइक फाइनेंशियली तो फिर भी लोग सपोर्ट कर देते हैं, बट अब उस टाइम पे हमें कैसे ट्रीट करना चाहिए इमोशनली सपोर्ट?
Yes, so cancer does not pose a very difficult health burden or financial burden to the family. It also has a great emotional burden for the person who has got the cancer as well as the family member. No one likes to see their family members suffer. So the role of a family member here becomes very important. Apart from providing financial security or so and so, you should be the person to take care of the person who's suffering from cancer right from the beginning of the cancer treatment to certain point of treatment where the treatment is going to end. So this continuum of care depends definitely on the caregiver or the family support. So what we like to tell the patients is have a good caretaker, and we counsel the patients and attenders together and tell them continuum of care throughout the course of treatment, adhering to the treatment course throughout 1 month or 6 months or even in some cases 12 months is dependent on the caregiver. So this emotional support as well as financial support or non-judgmental support to the family member is very important. Definitely is very important. And we have to support these kind of families, we have clinical psychologists also. So cancer treatment does not necessarily mean only about technical aspects of surgery or radiation or chemotherapy. So it definitely incorporates some kind of psychologists to give better counseling to the patient as well as the family member, because this is a burden on the family.
And if we will give mental support, means some kind of willingness will come.
Yes, definitely. The willpower to fight cancer is very important.
Yes, sir. So you are specialized in surgical oncologist. So what exactly it does?
Yes, I'm a surgical oncologist. It means basically I'm an oncologist. An oncologist is a person who is qualified to treat cancer. So oncological treatment is generally handled by three important persons. One is the surgical oncologist, one is the medical oncologist, and one is the radiation oncologist. Okay. These three form the most important aspect of oncological treatment. Okay. And in that, my role is the surgery. I diagnose cancers, I do biopsies for cancers, I do surgeries for cancers, and some surgeries need reconstructions also. You cannot just take the cancer from the body and just leave as such. It needs some kind of reconstruction to set the body right. So that is my role actually. And my role is also to integrate oncological treatments for the patients. The patients who come to me might require radiation treatment or medical oncology treatment. As I previously told, they might require psychological support also through a psychologist. They need a good nutritional consultation. They need to be taken care by a good dietitian during the course of treatment. And some genetic counselors are also put into these multidisciplinary teams. So this multidisciplinary team is usually handled by surgical oncologists. So with the rising cancer burden in the country, I think these kind of oncological team management is very important.
So you are doing a great work for our country, for our society, community, I can say.
Thank you.
हमारा ये पॉडकास्ट डॉक्टर्स डे स्पेशल है, तो कुछ मैसेज आप देना चाहिए हमारे व्यूवर्स को?
I would like to say one sentence is doctor-patient relationship. You know, the doctor definitely treats the patient. He treats not only the disease, he treats various aspects of the patient, especially if the patient has a cancer. So the trust should be placed on the doctor, and the doctor in turn should return the trust to the patient. So this good doctor-patient relationship will go a long way in treating the patients, and a sense of gratitude is always good to have on both the sides. So none of them is, it is not it does not come under the purview of a consumer thing. Actually, it does not come under consumerism. Nobody is also doing any service to others. So you meet the doctor treats you, yes, well and good. Have a good doctor-patient relationship to rest.
थैंक यू सर। और हमारे कंट्री में डॉक्टर को हम गॉड मानते हैं। वो ऐसा एक मोमेंट आ जाता है कि हमको लगता है कि बस जो डॉक्टर है वही भगवान है। और सीरियसली आज के डिस्कशन के बाद मुझे ऐसा लग रहा है कि हम इमेजिन भी नहीं कर पाते हैं अपने डेली लाइफ में जो आप लोग कर रहे हैं, क्योंकि हम छोटे छोटे से इवन लाइक स्टमक पेन, कोल्ड कफ, छोटे छोटे चीज़ों से हम घबरा जाते हैं, बट एक्चुअली जो ये लोग कर रहे हैं वो बहुत बड़ा माइलस्टोन है और बहुत बड़ा मैसेज है हम सब के लिए। थैंक यू सो मच सर फॉर ज्वाइनिंग टुडे एंड गिविंग सच अ नाइस इंफॉर्मेशन to us and to our viewers. So thank you so much sir.
Once again, thank you for having me in JConnect. Thank you.
Thank you sir.
Can we do it better?